Kakkar and Kulwant Singh sir. Good evening, good afternoon, and good morning. This is the 1618th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. SUNIL Raj R. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30, and from 8:30 to 9:30 we have the international session in English, and from 9:30 to 10:30 we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself, so that those who missed the session can watch it again, and you can subscribe the same without paying any money, and you can share it with friends, not only with homeopathic doctors or students, but also with your friends, homeopathic lovers. And today, let me come to today's guest. As you all know, Dr. SUNIL Raj R has completed BHMS and is the retired hospital superintendent of homeopathic department of Government of Kerala, and has more than 35 years of clinical experience, worked at various positions in the government sector: medical officer, GMO, superintendent, and state convener Ayushman Bhava, project of treatment and management of non-communicable diseases, and have worked at various positions in the organization of Government Homeopathic Medical Officers Association, including President, Secretary, General Secretary, etc. Has taken a lot of public awareness classes and instrumental in conducting various medical camps. And he has a very good reputation in the practice also in government sector. He's a well-known doctor in Kerala, and has taken a session last week here in this forum, and that we are all of you maybe remembering management of fever, the homeopathic perspective. But today, the second part of the same will be presenting in a different way, that is management of fever with homeopathic therapy. So this is a very important subject for the listeners of homeopathic fraternity. So we proudly welcome Dr. Sunil Raj to the session. Welcome, sir. You can unmute, sir. Your co-host.
Yes.
Yes. Yes. Management of fever, homeopathic therapeutics. Oh, you can go ahead, sir.
Yes. See, this picture is I have taken from the government Homeopathy hospital, Trivandrum, Eastwood Trivandrum. This display of pharmacy medicines which we are using. It's okay. See, I am
Okay.
starting the
Okay.
session. I'm
Yes,
starting
yes.
section
Yes,
from
yes.
quoting the lines from the Genus of Homeopathy by Stuart Close, MD. Homeopathy is both an art and science. The successful homeopathician must be both an artist and a scientist. His work must be both artistic and scientific. Theory and practice must go hand in hand. Technique must be governed by definite principles. Performance must be consistent with profession. I'm just going through the organ part also, maybe the management. Aphorism 2, the highest state of cure is rapid general, all know. Then the third aphorism is the what the physician clearly perceives what is to be cured in disease. There is knowledge of indication of the case, then knowledge of medicinal power, choice of the remedy, the medicine indicated, then proper dose, the proper period for repeating dose, and the obstacles recovery in each case. Then the aphorism 7, cause of condition, the etiology of the disease. Then the total symptoms, it's a very must to be taken in all cases. Total these symptoms of this outwardly reflected picture of the internal essence of the disease. That is subjective and objective symptoms. Then uncommon peculiar symptoms. Then aphorism 235 to 244 deals with the intermittent fevers. So here in aphorism 235, intermittent fevers, they prevail sporadically or epidemically, not those endemically located in marshy districts. We often find every paroxysms likewise composed of two opposite alternating states, cold or heat, heat or cold. More frequently still of these three, cold, heat, and sweat. Aphorism 236, the most appropriate and efficacious time for administering the medicine is in these cases is immediately or soon after the termination of the paroxysm. Aphorism 237, if the stage of epilepsy is very short, the dose of homeopathic medicine should be administered when perspiration begins to abate. Then the genus epidemicus. So in epidemic fevers, in situations where none are endemic, are of the nature of chronic diseases composed of single acute paroxysms, each single epidemic is a peculiar, uniform character common to all the individuals attacked. And when the character is found in total symptoms common to all, it guides us to the discovery of homeopathic specific remedy suitable for all the cases. This aphorism is the reason behind our genus epidemics. These are the medicines we discussed in the last session. Today I am going to deal with the specific cases in which therapeutics in connection with or in joining with the practice of medicine. Say diseases caused by virus with fever. There are so many viruses are in the atmosphere and they are causing different types of diseases in human beings, even in plants and animals also. So here the major viruses are influenza virus, human papillomavirus, herpes simplex, hepatitis, rabies, poliovirus, mumps virus, coronavirus, rotavirus, Ebola virus, smallpox virus, etc. So many viruses are there. The investigation of the viral diseases, direct detection by detecting antibodies or antigen by the body in response to the virus. Then PCR, polymerase chain reaction, RT-PCR. We are familiar with this in the COVID season. Then viral culture, electron microscopy, and DNA microarray testing. Then serologic test detecting antibodies, detecting virus specific IgM antibodies. Then other methods, imaging studies, X-ray, ultrasounds, MRIs, or CT scans to know the affections that organism caused in the body. Then non-analytical methods. The specimens we are collecting in virus fever are usually blood, saliva, phlegm, swab from the nose, throat, cervix, or other affected areas. Then urine, stool, then tissue samples. Then now I am directly going to the homeopathic therapeutics. Treatment of fever caused by virus infections. Any medicines in our pharmacy can be used for treating our diseases as per the total symptoms. But I am giving some specific medicines which are most commonly used during the diseases. First one is a viral fever, Rostox. I am only pointing the characteristic symptoms of each drug. Not I am dealing with all these symptoms. Rostox, catarrhal fever, stiff, lame soreness and bruised and feeling, physical restlessness, aggravation, lying still, and dry mouth and tongue. Then bryonia, we know the restlessness and tossing about, intense headache as if the head would burst at the temples, dull, stupefying, sharp pains over the eyes, ambulation by rust, that's the point marking bryonia. Slight movement will be causing terrible pain. Then painless on rising up. Some patients will be saying that whenever they are rising from the bed, they will faint. Then dry mouth and with much thirst for large quantities of water at rather infrequent intervals. That's a very important point for bryonia. And vomiting during fever, then constipation with no urging for stool. That will be pointing to bryonia. Then bell, general dry, heat with chills, little or no thirst, skin is hot, and a profuse sweating which brings no relief, fever, aggravation mostly at night. Then arsal is a very good medicine for viral fevers. That's a hay fever, great heat, aggravation after midnight, great heat at 3 a.m. That's a very important marking point for arsal. Great restlessness mentally and physically, complete exhaustion. Then gelsim is another good medicine for viral fever. Dullness, dizziness, and drowsiness. 3D, dullness, dizziness, and drowsiness. Shivering, chill. The patient will be shivering like anything. Muscular weakness and desire for complete rest. Then heaviness of head, eyelids, and limbs heavy. That's a very good symptoms for selecting gelsemia. Then Alimsipa, profuse catarrhal coryza. The nose runs freely, sneezing, irritable cough. Then Savadilla is famous for its frontal headache, sneezing and lacrimation on going to open air. Then dryness of mouth without thirst. That is Savadilla's picture. Then the next medicine, next disease, viral disease is measles, commonly affecting disease. Even though we are giving vaccination, our health routines are giving vaccination against measles. Measles is prevalent in this time. That is public sports. Then sore throat, skin rashes, pinky eyes, watery. These are the symptoms pointing to measles. The remedies usual remedies are aconite. Let's say acute medicine in the initial stages: itching, burning skin, rash, rough, and miliary. Then with all the fears and all, we can select aconite. Then bell is famous for its suddenness, bright red rash, sore throat. Then measles, euphrasia is a very good remedy. Great catarrh, streamy burning tears, photophobia, intense photophobia is there, running nose, intense throbbing headache, amelioration as soon as the rashes appearing. Then copious acrid lacrimation. Gelsim is another medicine for measles, sneezing with sore throat, severe heavy headache, occipital pain, heavy lids, itching red skin. Then let me see that. Then next medicine is pulsarilla. Pulsarilla, cough is very important. Sits up to cough, dry at night, and loose little in daytime. There is earache, eye agglutinated and pure discharge, and diarrhea, pointing towards the pulse in measles cases. In Cali bite, pustules on the cornea. It's very marking symptom for Cali bite. Swollen throat with catarrhal deafness, ear compliance with swollen salivary glands. Laryngeal affection with hoarse, dry, whoopy cough. Then the discharges are stringy, ropey discharges. Then arsal is very useful in malignant type or black or hemorrhagic measles. Very good medicine for in the later stages of measles. Weakness, diarrhea, delirium, restless, debility, fatigue, stool, offensive and exhausting, then insidious pneumonia also. We can go for arsal in these type of cases in the later stages. Then chickenpox. Let's say typical Rastox comes first, bell comes first, then the Rastox, typical small vesicles with itching. First medicine is aconite, then bell, bryonia, etc. All the symptoms are as noted earlier. Then the typical vesicles, Rastox vesicles, this chickenpox vesicles will be binding. It's a chickenpox case. Then antidote is a very good medicine for chickenpox, rattling cough with no expectation. Delayed cases, blue or pustular eruptions, weakness, drowsy. Drowsiness is very important for antidote. Then sweaty case, sweat is prominent. Then arsal cases in the second stages, intense itching is there, then we can give ourselves. Then in case the vesicles are separating, then there comes the role of Merxol. With this, there is typical Merxol symptoms: profuse salivation, profuse sweating. You can note all these things. If the vesicles are showing the tendency to separate, Merxol comes. Then verulinum, we are using this verulinum as a preventive for chickenpox. Then Serratia purpura, it is commonly written in about the disease, arrest postulation. But I am not, I won't give this medicine because we need the symptoms, the eruptions to come out for a complete cure. Then mumps is another medicine causing fever with the virus fever. Then bell, right side is swollen, right side glands are swollen, hot, red, and sensitive to pressure. Tustox is very good medicine for mumps, left-sided. And the point is secondary parotitis. That is, parotitis coming after surgery or another infections. Tustox is very good medicine. Parotid and submalacetic glands are swollen, highly inflamed, enlarged, then herpes on lips. Then mercurius, right-sided, slight fever. Mercurius comes after late stages threatening the separation. Then tenderness, salivation. Salivation is offensive sweat also. Then when we look at the mouth, tongue is a large flabby tongue with foul smell. Then another medicine is pulse. When the ear is involved, severe pain, emulation by heat, there is pulse comes. Then useful to prevent orchitis, mammary complications. In case of mumps, mumps is a very is famous. Mumps is famous for metastasis to the orchitis, this testis and the ovaries and mammary glands. And the pulse is very good medicine to prevent the metastasis. The abrotanum, clematis, aurum, clavoger comes as will be helping us to prevent the metastasis. Then lacus is, there is purplish swelling, aggravation after sleep, aggravation touch. Then parotinum is an also, we are giving this parotinum to prevent the mumps cases. As a preventive medicine, we are giving parotinum. And also to complete the action of the other medicines also we are giving parotinum. Then Pilocarpus micro, that's Liborundi. It's giving for limiting the duration. If the mumps is going in a prolonged way, not subsiding, then it is a very good medicine for to limit the duration. Saliva is a peculiar disease. Saliva is viscid like white of egg. There is profuse sweating also. Then herpes zoster, shingles. Prostox is a very good medicine, typical rashes. Then Herpes is there. If there is burning, stinging pain with much swelling, vesicles large and confluent, ulceration with great itching, and aggravation from warmth, ambulation from cold. Herpes comes first. Then arsal. Here in arsal, herpes zoster eruptions are confluent eruptions with intense burning, aggravation from cold, and ambulation from warmth. Then sleepless after midnight. That's very good medicine. That is a very good point for giving arsal. Then meserium is there, very good medicine for herpes zoster. Terrible itching is there. Then severe neuralgic pain, vesicles from a brown scab under which a purulent matter exudes. That is typical picture of meserium. Then renal bulbosis, burning with intense itching, aggravation contact, bluish vesicular pustules with thin acre fluid, blister-like eruptions in palms. So I am only giving the medicines with peculiar symptoms. Any medicines in the or medication can be used for these complaints. Here I am pointing out 9 medicines only. That is with the peculiar symptoms. Then cistus canadensis, extreme sensitivity to cold, glands inflamed and indurated, general itching, prevents sleep. Cistus canadensis. Then Prunus spinosa is a very good medicine for herpes zoster with the dropsy, itching on tip of fingers as if frozen. Then another good medicine for herpes zoster is Cantharis, the typical burning. large blisters with smarting and burning. If there is any urinary complaints associated with this herpes zoster, candidate will cover all those things. Then some Sempervium tectora, erysipelas affections, flushed surface, and stinging pains. Then dengue fever, headache, pain, joints, rashes, nausea, and vomiting. I'm not going for the details in this case because the picture will be giving or pointing out the medicine. Bryonia, Bell, Rustox, Epitorium, Rustox, Apis, Arsa, next, Chinacea. Chinacea is a very good medicine for if the platelet counts are reducing and ESR is raising, dengue fever, Chinacea is a very good medicine. And if we are treating the case with homeopathy medicines in dengue fever, there is no reason to see the lowering of count of platelets. Then Chickenpox is also very good, famous for the low platelet count. Then the chikungunya, then swollen joints, severe joint pains, muscular pains. Epidemicus is a very good medicine that is break bone fever. This whole body seems as beaten. Then bryonia, rustox, arnica, ledambol, pulse. Then post-chikungunya, medoranum, causticum, clumbamate, calcareacar, lycopodium, natrium are very good medicines for the affections after chikungunya. So I am covering important medicines for the fever caused by the virus. Then disease caused by bacteria with fever. So there are so many bacteria are there in the atmosphere causing different kinds of diseases. Streptococcus, Vibrio, Bacillus, Salmonella, Spirillum, Brucella, Clostridium. So investigation of this bacterial diseases with fever, laboratory investigation, routine examination, blood, urine, saliva, sputum, and feces. Then blood and sputum culture. Then gram stains especially for TB cases. Then biochemical test, mass spectrography, chromatography, and nuclear. NMR spectroscopy to identify microorganisms. Which microorganisms is causing the disease? We are doing the NMR spectroscopy. Then skin biopsy. Then aspiration of the fluid first to find out the causative organism. This is important for a allopathy system of medicine to find out which medicine is giving good cells to kill that bacteria. Then biomarker test to measure CRP, procalcitonin, and pro-inflammatory cytokines. So I am giving the first medicine, homeopathic therapeutics for the diphtheria cases. Epismell is a very good medicine. Throat, fiery red, puffy, varnished, aggravation by touch of food, water, heat, etc. Epis will be giving good coverage. Then with ourself symptoms, if there is the membrane looks dry and shriveled, then ourself comes. Then if the putrid is there, bacteria comes. Then in lac symptoms change repeatedly from side to side. Here also, in throat also it comes. Then shining glaze appearance, pearly white. Then stiffness of neck. Then lac will help. Then lachesis. Then mersinaticus. That is necrotic destruction of the soft parts of the palate and fauces it there. Then mersinaticus is a very good medicine. Then quite like if the pain is there and it is pain is extending to ear and all. Quite like it comes. Then Calibec, the ropey discharges there. Then diphtheria is also to prevent it. You can give to other members in the family to prevent the spread of TB. Then typhoid. It's a very good medicine. Let's say symptoms during the pregnancy. We have to differentiate the stage of typhoid to treat the case. Pregnancy are closely watched and the homeopathy remedy properly applied. A very few cases need to go to the course of typhoid. In the initial stage, if we are giving homeopathic medicine in a proper way, there is no chance for the proceeding to the typhoid stage. It will be aborted in the initial stage itself. So there is first medicine, and here the initial stages medicines are bryonia, The patient is with the dread of motion, headache, and all, fever and all, these are type of symptoms. Then Bryonic can be given. Then Naxomica with severe headache with consequent there, Naxomica can be given. Also, it's a very good medicine in the initial stage of typhoid. Then much chilliness but prefers open air. If the patient is feeling chilliness but prefers open air, then bell, gelsemium, there is a prostration. Is gelsemium comes, and muscular soreness and putrid smell from the mouth, discharges, putrid discharges, and delirium. And the patient will be very weak and he will be falling asleep in the midst of answering bacteria. It's a very good medicine. Then other medicines are aurum triphyllum, then phosphorus with pneumonia, typhoid with pneumonia, phosphorus is a very good medicine, bleeding tendency is there. Then burning of palms, thirst for icy cold, that is phosphorus. Then acid mode, in case of acid mode, extreme prostration, hemorrhage from intestine. The other peculiar of acid mode is lower jaw drop, then involuntary bloody stool and urine. It's the case for the patient drops to the, he falls to the bed whenever he's trying to stand, he will be falling back to the bed. That much prostration is there in muriatic acid mode. Then phosphoric acid phos, stupid, indifferent, painless, yellow, watery, light-colored stool if is there, white stool is there, then acid phos will cover the case. Then lachesis also we have to give in later stages. Hemorrhage is of dark decomposed blood in case of lachesis. Then total sordus is a very good medicine for in the later stages of typhoid. Vomiting dark green matter. Blood oozes from rectum while standing or walking. That's a typical picture pointing towards the total sordus. Then termidin is another good medicine for typhoid. Hemorrhage, dark, passive, fetid, enormous distance from abdomen, tympanitis. With these symptoms, termidin will be helping to deal with the typhoid case. Then taxum is the typical tongue, map tongue, chilliness after eating and drinking. Then fingertips cold. Then arsal is a very good case, a very good medicine in the later stages of typhoid. That the patient is going to from bad to worse. The case is deteriorating. Then arsal will help. Then vaccinum meritless tincture yellow understood. Then antigrowth. If the typhoid is relapsing, coming again and again, then I think antigrowth is a very good medicine to prevent that relapse. And ipecac also is very good medicine to prevent the relapse of typhoid fevers. Then second core, that's also like arsenicum album. Bad cases when the patient is on the verge of death. Then I am coming to the autoimmune disease and fever. As you all know, the condition where the body's immune system mistakenly attack its own health issues. Almost all the autoimmune diseases are coming after some other infections. So there will be, we have to take consideration of the previous infection also to cover the autoimmune diseases with fever. The first one I am giving is the rheumatic fever, then fever, joint pain, red raised lattice-like rash, then small painless skin bumps are there, fatigue. With this picture, there is rheumatic fever is presenting almost with this picture. And if we are getting other symptoms related to our drugs, we can go for that drug. Prostox, then Maxol, then Pyrogenium. Pyrogenium is picture is better beginning to move, but aggravation by continued movement. The patient will walk for a small distance, then sit for some time, then walk, then again sit and walk. Then Streptococcinum is a very good medicine because almost this rheumatic fever is coming after streptococcal infection of the throat or any other organs. We can go for this streptococcinum. Then Pulse, tuberculum. Then another medicine is salicylic acid. That is elbows, knees, joints, affection of elbows and knee joints, great swelling with redness, high fever, piercing type of pain, ambulation heat. Then we can go for this salicylic acid. The next autoimmune disease with fever is systemic lupus erythematosus, SLE. It's a sign of an overactive immune system. Skin rash, a red butterfly-shaped rash appears on the cheek and nose. The typical rash for this systemic lupus erythematosus. Then hair loss is there. Then swollen lymph nodes on neck, armpit, groin. The Raynaud's phenomenon, fingers and toes white or blue when exposed to cold or stress. Then high mark test for the SLE is anti-RIP, antibodies against ribosomal protein. Then most common remedies for SLE is almost all the medicines are coming. These are the typical medicines for systemic lupus erythematosus. Sepia is one, then agaricus mus, then rustox and mercurius. Then another medicine is another disease with autoimmune disease and fever is rheumatoid arthritis, joint pain with low grade fever. Medicines, all medicines, any medicine, rustox, all medicines can be used, but I am giving only the specific medicines with their important diagnostic points. Cellular media, enlarged and inflamed joints with shifting pain. Then guaiacum is a very good medicine for rheumatoid arthritis, chronic articular rheumatism, distorted joints with congestions, rigid hot swollen, and with painful contractions of muscles. Then ambulation may cold. Then guaiacum can be considered. Then formica is another medicine for rheumatoid arthritis, muscles torn from their attachments, weakness of extremities, suddenness with restlessness, ambulation after midnight, and rubbing. Then lactic acid is another good medicine. If the rheumatism is with diabetes and the joints of the shoulders, wrist, and knees, then chilly limbs, lactic acid comes. Then malaria, if the patient is complaining rheumatoid arthritis after malaria fever, then we can go for malaria. Then manganum is another good medicine with the burning in sores, useful in recurrent complaints. Another autoimmune disease in fever is sweet syndrome. That is febrile neutrophilic dermatitis, skin condition with sudden fever, red painful lesions with neutrophilia. The important medicines are natrium, that's painful nodules, Tanella, painful pustules, Calimore, subcutaneous swelling is there. Then Arnica montana, tenderness is there, then Arnica can be considered. Then if there is any tendency to malignancy or pyemia, then protransferase can be looked for. Then autoimmune disease with the fever, vasculitis. Here the red, purple spots, then itching, headache, vision problem, diarrhea, tinnitus. Remedies, lycopodium, lachesis, rustox, bovista. Bovista, if there is blunt instruments, leave a deep impression and it can be considered after giving rustox. Then arnica, hamamelis, phosphorus. I'm not detailing about all the symptoms of this because all the symptoms you are knowing. Then phosphorus is there. Then acid sulfur is another medicine. If the vasculitis is caused from mechanical injuries, and if there is echinosis, petechiae, black blood is there, then sulfuric acid comes. Then fever with blood clots. That is, first one is pulmonary embolism, a blockage in a lung artery caused by blood clot or other substances. Here the symptoms are chest pain, shortness of breath, cough, blood and bloody mucus is there with this expectoration. Then bluish lips or nails, low BP. So diagnostically is CT scan. CT scan is there. Then MRI, duplex ultrasound, note the blood flow. Then pulmonary angiogram. Then the D-dimer test. Then the nowadays D-dimer test is famous for the complaints after vaccination. They are suggesting this test to note the any thrombus formation is there. Then remedies for this pulmonary embolism, arnica, cough with weeping and lamenting, bloody expiration, pleurodynia. Then lacusis, suffocation, strangulation on lying down, larynx painful to touch. Then apism, intolerance to heat, burning, stinging pain, edema, suffocation, and the patient is feeling that the birth is the last one. There is a feeling to the patient, apism will cover. Then vipera, bursting type of pain, compression of chest, difficult to take breathe. Then phosphorus is a very good medicine for this pulmonary embolism, tightness across chest. Then repeated hemoptysis, congestion of lungs, aggravation by lying left. Then another picture with blood clots with fever, that is deep vein thrombosis. Here the blood clots formed in a deep vein in the body. That's leg swelling is there, leg pain, tenderness, change in color skin, then warmth on the affected limb. Important remedies for this deep vein thrombosis are, first one is the bell, redness and pain, then arnica, black or blue discoloration of the skin, great fear of being touched. That's a very good medicine, very good symptom of arnica. The patient will not allow any person to come near. Great fear of being touched, bruised or beaten feeling. Then vipera, pain, aggravation by hanging down the limb. Pain unbearable, bursting sensation, amelioration by elevating the foot. Then lacusis with hot perspiration, bluish or purplish, purpura pain, pain aggravation after sleep. Then another good medicine for this deep vein thrombosis, thiosinamide, a good resolvent. A very good resolving power is there for the thiosinamide. Then Bothrops gland, thrombosis, and if there is hemorrhage tendency, Bothrops gland can be used. Then another good medicine for deep vein thrombosis is Sakeli core, burning emulation by cold. Skin feels cold touch, but covering not tolerated. That's a typical picture of Sakeli core, burning emulation by cold. Skin feels cold touch, covering not tolerated. Then I am coming to the last portion of the homeopathic therapeutics. I have just covered some of medicines and some of diseases causing fever. Then the last coming to the last portion of the my presentation, tips to remember. See, first is I am giving that medicines to bring out suppressed eruptions. In case of viral fevers, especially the chickenpox, measles, the germ measles, mumps, in all these cases, when we are not allowing to come out the eruptions or complaints, the patient will be suffering like anything. Sometimes may be affecting the brain also. And the patient will be in a distressed condition. They are giving medicines to reduce the fever. And fever is coming after 1 or 2 days. And the patient will be in a very distressed condition, very difficult condition. In that case, we will be giving the medicines to bring out the suppressed eruptions. The first one is pulsatilla. Then epismel. Then singamet. It's a very good medicine if the patient is suffering from convulsions due to the suppressed eruptions. Then singamet will help to bring out the eruptions and will help to give relief to the patient. Then Aliandris is a very good medicine if there is bleeding of gums and nose. Then Aliandris is a very good medicine to bring out the eruptions which are suppressed by any other medicines. Then Cupromet also is a very good medicine in case of convulsions with the suppressed eruptions. Then the fever annually returning. These are the major medicines in which we are getting fever annually. Carbovec, then sulfur, paracetamol. When the well-selected remedy fails to act, an intercurrent remedy will help to clear the obstacles. That's a very good point to be noted by all of us So we are giving a well-selected remedy, but the patient is not responding up to our expectation. If the situation is like that, then we have to think for some obstacles in that patient, which is not allowing the well-selected medicine remedy to act. So that's the constitutional drugs are very good. They will be helping us to make the vital force active to act by the well-selected remedy. Then nosodes. So many medicines are there. We have got enough experience with this nosodes. That when the fever is not responding, or when a patient is not responding with the medicine, we used to give the nosode. Spironolactone is a very good nosode. Then sorinum. Then medorinum is also a very good nosode. Then the anti-miasmatic remedies are also will be helping us to help to go with the case forward. So these medicines, constitutional medicines, nosodes, and anti-miasmatic remedies will be helping us to remove the obstacles which are preventing the well-selected remedy to act in the patient. That's the beauty of homeopathy. So we have to be familiar with all these things. Then only we can treat the patient with ease. So we have to do hard work to note the acute symptoms, the etiology symptoms, and all these things, along with the constitution of the patient also, even in acute case. That's the beauty of homeopathy. So we cannot give some medicine and it's not acting. We can't stay like that. And we have to be familiar with all these things: complementary medicines, then inimical medicines, antidotes. So you have to be familiar with all these things to treat a case. A study is required to treat patients with homeopathic medicine. It's nothing easy. It's not easy. Giving some medicines according to that fever combinations, that is not homeopathy. We have to do hard work in each case to get the totality of symptoms to cover the medicine. If we are getting a result with these things, we will be enjoying, we will be feeling very blessed, and the patient also will be blessed with the single medicines, which what Hahnemann preached. Then etiology plays a vital role in the treatment of acute case diseases. That's a very, we have to be noting the etiology factors. Etiology, what is the causative factor causing this disease? In all cases of acute cases, especially. First one, we have to remove that obstacles, which will be causing the patient sick again and again. So we have to remove the etiologic factors. And so many medicines are there with this etiology only pointing towards the minimum. So many medicines are there. If there is, in case of Rustox, the camera, if there is a history of getting wet, then Rustox, dull camera, rhododendron, all the medicines will be coming to help us. Then if there is food poisoning, diarrhea, vomiting with the food, bad food, we can go for this ourselves. So there on comes the etiology, importance of etiology. Then my last point is homeopathy never fails. This is a system based on nature's law of cure, and it is experienced and experimented and thoroughly rechecked by our master Samuel Hahnemann himself. So homeopathy never fails. The failure is from our part. If we are not taking the case in proper, if we are not getting the correct picture of the medicine, we are not getting the correct minimum of the case, if the dosage is not sufficient to evoke the vital force, then if the miasmatic any miasmatic picture is not noted by us. So all these factors, so many factors will be preventing our success in the cases. So we have to be familiar with all the medicines, what is indicated in the disease, what is the disease. We have to know the exact pathology of the disease to assess the prognosis of the case. Then what is curative in medicine, what is the proper dose, what is the time of repetition, and what are the obstacles of the recovery. All should be noted by us as a physician to give a cure by homeopathy. And thank you all for the patient listening. I'm coming to the end of the session. Thank you all. Thank you.
Thank you very much, Dr. SUNIL Raj, sir. It's really a brilliant session indeed. And you covered almost all medicine, all the reasons behind the illness and how it can be managed and what are the things to do, what are the things not to do, and what is the importance of complementary epidemicus. Knowing all those things, one can go ahead in the treatment of fevers with ease. As you rightly pointed out, that even there is no specific in homeopathy, but of course, the constitutional remedy can even work brilliantly in acute diseases and viral diseases also. And when to give, where to give, all these things were also beautifully narrated. Anyway, congratulations, and it's the time for discussion. Those who want to participate in the discussion may raise your hand so that we will allow you to unmute yourself and you can ask your question as well as suggestions. Yes, Dr. Manoj.
Thank you, Dr. Ganesh, Dr. SUNIL Raj. Nice presentation, and I think one point you mentioned is left to mention. I think the role of opium when the medicines are acting. I think it is given on the footnote of about 188 or 83 is often useful. Then again, from this fright, especially in case of children, some sudden noise or some other causes can create fever. Then definitely aconite is the most important medicine.
Sure. Opium is also very good medicine.
Yes. Then you mentioned about the advantages we have, especially the etiology, then this annual recurrences. These are the specialty homeopathy things. No other systems can, they will be silent on all these things. But homeopathy is well versed and well conversant about that. That's the most advantage. That makes homeopathy the most practical system of medicine. Then you mentioned about the obstacles of medicine or this recovery. That's also very important. As you mentioned about the work has to be done to reach a remedy. As rightly mentioned by our master, it will not fly into your mouth like roasted pigeons. It requires the hard work. Nice presentation. Thank you.
Thank you, Dr. Manoj, and substitute Dr. Ibrahim Pavankar to add something more. I can ask the question also.
Thank you, sir, for allowing me. Sir, it was a very nice presentation. It's a very difficult topic, so we are really thankful to you for presenting this. Can you give us some guidelines about auxiliary line of treatment in all febrile cases? Because usually relatives ask us, sir, what to do when we visit them or give medicines. Can you guide us for that? What auxiliary line of treatment should we advise along with our homeopathic remedies?
Which one? I'm not. It's obstacle medicine, diet management, or auxiliary management.
Yeah.
Yes.
It is
Sure.
a part of that. Diet management is a part of that.
Yes.
So can you suggest some auxiliary line of treatment so that the relatives can take care for febrile patients?
So I have covered that topics in the last session. In the last session.
If you don't
Then
mind,
we have to give plenty of water in these fever cases.
Yeah.
Very good nutritious food in these cases. Then we should be familiar. We should be cautious about the visitors coming to these cases. We should prevent the visitors at any cost. Then very digestive type of food should be given to them. With the nutritious, avoid the pastry, then oily, spicy. That type of food should be avoided.
Okay,
Then,
the tepid sponging, people are confused about tepid sponging. I've seen the patients are
yes, yes,
having
we have
chill.
to, that in case of fever, for the
Yeah,
mostly for the children. So to prevent
yeah.
the epileptic attacks due to
But what
fever.
happens during chilliness, the relatives they do tepid sponging, and the patient gets more chilly because of the tepid sponging. That is the
No,
observation.
we are advising the sponge with the lukewarm water.
Lukewarm water, and actually,
Lukewarm.
what I mean, I've seen homeopaths confusing, and patients also shouts with lukewarm water also. He should be given during the heat stage. Honeymoon has advised.
Yeah,
Tepid
if
sponging during
when
the
we are
heat
giving
stage.
this lukewarm water sponging, no, the patient will be able to sweat.
People give it in chill state, and the main problem again increases. That is the main
Yes.
main problem it occurs. Thank you, sir. You have answered very well, and we have cleared our doubts. Thank you, sir.
Thank you.
Yeah.
Thank you.
Yeah.
Yes,
Excuse me, Dr. Ganesh.
yes, enough money.
Let me add a few points here. Because the accessory management always conscious about the medicine. We know how Hahnemann allowed in acute diseases. If the patient craves to meet somebody, company decides, definitely you should be allowed. Then
Yes.
again, I have some reservation on this. This tepid water sponging, especially if the patient is you give in the case of Rustox, what will be the consequence? Definitely the patient will produce some sort of disturbance. So yeah, I asked about to a pediatrician doctor why you are insisting on this water sponging. He frankly said, "Doctor, I don't know what is the reason." Because we know that what is the reason for rise of temperature? The pyrogens that will affect the thermoregulatory mechanism, thus it will increase the temperature. Then how can you control that process? How can you alter that process by using this water externally? I don't know what is the logic of that. Then again, in my observation, often the pneumonia cases are occurring because of this pediatric war as a result of this methodology.
Yes.
I suspect so.
Yes. Then another thing is we should be hygienic, especially in case of this typhoid and all cases. We should be very hygienic and should be avoiding all the vectors in that area. And we should advise all the patient, the bystanders, and the families around the house to take boiled water, sufficiently boiled water.
Yes.
Anyway, these are the things to be noted when one treats acute diseases, particularly in fever conditions. You will have to look at the patient, what he is doing, why he is doing all these things. Sometimes patient may be in agony, pain. Sometimes it may be slowly coming, and sometimes it may be in a very fast mode. In all those cases, we have different remedies, different medicines also. That's the beauty of homeopathy. No particular medicine is specific for at any situation, but as per the symptoms that you see in front of you is to be on which to you need to prescribe. And Dr. Sunil Raj doctor has mentioned how one can differentiate the bryonia from belladonna from rustox from Pulsagla, and of course, how will you manage a case of eruption that is not coming out in a case of eruptive disease? In those conditions, also, what are the medicines to be given and why it is to be given? And if the eruptions are not fully coming out, that may make some problem in the patient in the future, or sometimes it may end up with a complication also. So those are the things to be noted when you treat the patient. And of course, while managing acute diseases, you will have to do something because the test of the patient needs to be taken into consideration. Sometimes patients usually take not much water, but that fever, they may take a lot of water. So that is the basic difference between test in that particular patient. Whether the patient is taking a large quantities of water before a fever or during fever, all these things to be differentiated. And then sometimes a patient usually take cold water, but only during fever he is taking
Yes.
hot water. In those conditions also, we will have to differentiate.
The Parsala cases are faceless during fever.
Yes.
Not that also.
As we know that every symptom in Pulsagla is changeable. in test
Yes, yes.
also. They may be in, they may not have test, but at times they may have test. But always there is dryness in the test. Dryness with the test results. That is the basis of pulsatile. But in case of bryony also, at times bryony of patient may have severe test, but yeah, sometimes it may not have no test at all. At times, a bryony patient like to take a lot of hot water also. So it all depends upon the totality of the symptom. In those conditions, the physician need to be an observer at that time of the disease, as well as you should know how he behaved before the infection.
That's the beauty of homeopathy.
Yes,
The peculiar
exactly.
individual pictures vary from patient to patient,
Yes,
grading up to the minimum.
yes. After yes, it is the time to wind up the session. I invite Dr. Imrani Bhatkar to say a vote of thanks to the session because he's an active participant.
Next.
Thank you. Thank you. Sir, thank you, sir, for giving me the opportunity. Sir, you have given us a feast of homeopathic therapeutic drugs today, which explain their characteristic symptoms in the fever. So the difficult topic, you have made it very simple and to the point. So on IFPH platform, I will be really happy from everyone's side to say you happy as well as congratulations for your good topic. Thank you, sir.
Thank you.
Yes, the day 1618 was really a brilliant one from the Hindi session as well as in English session also. And tomorrow we will have a session from Dr. Anju. She is from Qatar. She will be talking about another big subject tomorrow. Hope all of you will be joining us tomorrow at the same time by using the same link we shared for the meeting today. There will not be any change. You can, those who missed the session can watch the videos of the same tomorrow by evening. So you can subscribe it by searching IFPH homeopathy without paying any money. That's the beauty. You can share it with anyone, whether it is a homeopathy student or a doctor or anybody, somebody else. Okay, thank you, Dr. SUNIL Raj, and those who participate in the session. With that, we come to the end of the day. It's over to Dr. P. Shaila to moderate the Malayalam session.